All right. I know Clayton's still holding out. The secret to getting PRRS positive pigs less than 2%. So
I got the solution.
Okay.
Find a packing plant that take them at 15 pounds.
Yeah, that would do it.
And just don't write down the mortality, Chris.
Just don't write it down. That's it. Just don't count them, right?
Clayton and Brigitte, you both talked a little bit about communicating with people in the barn when you're actually auditing the processes or working through them. Do you have any tips or tricks to share with us of ways you have coordinated to communicate or evaluate the execution of the processes you're asking people to do?
So on different levels, we do different things. So we are currently in our system, we have 15 herds that are under a true herd closure looking for elimination. Each of those with the sow production manager, the farm manager, and their leads, we do hold a half-hour meeting once a week just to discuss things. And that's purely a discussion of what they're seeing on farm, what they're doing, what their challenges are, and try to come up with solutions purely from a phone desk perspective. Beyond that, the best way that I have gotten to audit the process is if there is something from a diagnostic perspective or from a clinical picture that they're painting that does not seem appropriate for where they are in that plan, I will go and physically do that process with them or ask the service person to physically go do the process with them. I have yet to find a checklist or a sheet that gives me, that I can hand a farm manager, I can tell a farm manager, go look at this and whatnot. And they do, and they come back with answers. And sometimes, yes, you discover something in there. But there has never been anything that's been better than me physically getting in that barn and looking at the process I'm suspect of, or the service person doing that for me. It's definitely time consuming, but at the end of the day, it seems the most valuable thing to do. I
thought Brigitte gave a great answer. The only things I would add to it, Amy, are number one, there's a time for auditing and a time for not auditing. And what I mean by that is if the person or the team that you're going to go audit, if they've only been doing this for like a week, it's not realistic to expect them to do a good job. So we're probably wasting time on the audit when we should just do the work with them and train, right? Only audit if you feel like there's a good expectation that it's going to be done well. And if the reality is the people are new at the process at least, then just spend that time teaching them how to do it, and don't worry about the audit because it's not going to go well. The other thing I would say is, well, I haven't had much opportunity to do it in the U.S. I know you guys have worked a lot with camera systems and some remote auditing tools. I've gotten to work with some farms in China that had unbelievable camera setups. And they would have a biosecurity manager for the farm that would sit in a room. And I think one farm I was at, you could put up to 144 cameras on this massive wall of LCD screens at the same time. And some of those cameras have like speakers. So you can literally grab the walkie-talkie and you can talk to the person who's bringing supplies in or who's loading out animals. And the power of doing that is awesome, because it's not just auditing, you are fixing it in real time. So I know that seems kind of silly to us, right? But it's that technology is available, and it's something that I don't think we use it enough today. Do we need 144 cameras all on one screen? No, right? But one at the loadout area, one at the employee entry area, one at the mortality drop. I think those have a lot of value.
So one other thing that we have done, and we started it with biosecurity, we made a biosecurity officer at the farm that essentially was the gatekeeper to all the biosecurity processes. They weren't a farm manager, they weren't a lead, they were somebody that we thought had a lot of potential within the system to grow. And so with our most recent herd closure that we have, I went ahead and appointed someone very similar concept to our biocontainment processes that we're doing within the farm. So they're the one who looks and sees what's going on in the farm, and then they are included in that once a week meeting, and they report back like, yeah, we're not doing X, Y, and Z, or we're doing a really poor job of X, Y, and Z, or so-and-so doesn't know how to do it. So then we can really spend time determining if we need to, like Clayton said, go back and audit, or if we need to go back and train.
All right, excellent question. Thank you, Amy, for starting us off. Other brave souls out there. Nobody else has got PRRS problems in Grow-finish. Is that what I'm hearing? No other questions? All right. So I'll throw one out, but I fully expect there's going to be some hands raised while I'm waiting for the next one. Oh, okay. Dan's got one. All right. Fire away, Dan.
Well, I'll preface this by saying that I sell ibuprofen and meloxicam, but so I've got a conflict here. But I did want to ask. I was kind of surprised nobody mentioned the use of anti-inflammatories in their presentation, other than Dr. Mason briefly mentioned the aspirin. And I don't know about the rest of the people in the room, but I would guess that most of us probably look at aspirin as a placebo. And I guess I was curious if any of you have had any experience with a real anti-inflammatory, whether it be the salicylates, which reach a therapeutic level, or ibuprofen, meloxicam. Just curious if anybody's had any real life experiences that they'd be willing to share.
I'll start it off. I think I can't remember if Carricker was the lead paper on it or if he had a student who did it, but Locke did a nice review. It's been 10 plus years ago, but it's out there on the differences between acetyl salicylic acid and then the salicylates. And I would say step one, go read that information if you're thinking about choosing, and particularly if you have to convince your boss to buy salicylate because it's more expensive. But I do think there's a difference between anti-inflammatories, as you said, and the other thing that I would highlight is I think some of the data from this morning, I can't remember if it was JQ's data that had the fevers, the high temperatures. I mean, 106 Fahrenheit in those pigs. Mm-hmm. That's crazy high, right? I can't imagine what I don't think I remember having a fever of 106, and that's got to be miserable. So I think there's a value proposition there. I would say in terms of target opportunities, Dan, sow farms that are going through a massive PRRS break that have a big water vault, it's somewhat practical to be able to dump some of those anti-inflammatory products in those water vaults and dose them relatively well. So I think that's an opportunity sometimes producers don't necessarily see or overlook.
Nobody wants to touch that one. All right. Anybody else? All right, I've got one for you guys. What do you guys do? So for, let's say, lateral PRRS breaks with complicated, respiratory disease complex, what sort of therapies do you guys usually prescribe for clients? What sort of things are you usually targeting? What sort of things do you look at, evaluate? What's worked well in some of those situations for you guys? Water medication, mass medication, what sort of things have you guys had some success maybe with some of these newer, highly pathogenic, high-path strains? I liked how Luke put that. You haven't answered one, Luke, so I was going to make sure you had one.
I would tell you that we've done a lot of trial looking at mass vaccination with mass treatment with broad antibiotic, either Draxin or Enroflox, penicillin, compared to water medication. Once you get into the acute phase in the nursery, there's really no medication that appear to be working. So when you get on the very, very high path aspect of it, you got to be careful with your employee to really treat the absolute worst so they don't start treating and just get treatment fatigue. Yeah. In the water, I would tell you that when we look, what appeared to have worked the best has been getting Draxin shot, one at processing, one at weaning, in those flow before they get placed. Okay. That has appeared to kind of reduce some of the loss we've seen. And then we work with different water med. There's a strong aspect that, you have secondary infection, you have to control them. When I go back and look at all controlled trial we did, it's very hard to find anything working better. Okay.
I would just echo, know your flow. I mean, know what secondary agents are likely to give you the biggest problem and target that.
Same? Okay.
Same.
So and I think that was probably part of the question was, in those situations, are you better off leaving them alone and putting something in the water, or are you better off targeting, going in and trying to mass inject them and then leaving them alone? That was maybe part of the question as well.
And this may be kind of where you're going with it, Chris, but one of the hardest parts for me as a veterinarian is when do you somewhat pull the plug on the mass medication, and not to say you give up, right, because that's just so defeatist, but the reality is, right, economically you have to evaluate the value proposition. And you're spending a lot of money on those mass medications, and if there isn't an impact, you have to be judicious with the dollars, but it's a really tough balancing act for welfare, and like Brigitte said, for the mental state of the crew, right? I mean, anytime you're telling somebody the patient's gone, it's a horrible message. So somebody else is going to have to give the talk on how to do that well, because I suck at that.
Luke's got a response.
Yeah, you cannot.
Luke's not going to do that.
And it's I got to be out of my comfort zone there because I got to be all nice and flowery. But you have to be very understanding that none of those solutions make you. People want to do a good job in the farm. They want to do the right thing, and you tell them, don't treat, you don't need, it's the fetus, and if they treat like crazy and doesn't work, it's also, so you've got to be very, I understand the situation you are in, but right now the road we choose is the best based on that. Don't assume that it's always going to be the same, because situations change all the time, but you have to be able to recognize it and be able to tell you, I'm behind you, I help you, it's not your fault, but right now that's our best course.
Yep. Very good. Go ahead, Paul.
Yeah, so I had a question on the sow farm side. We got the processing fluid, we got the blood or family oral fluids on piglets. Do you guys have a good program that you can use diagnostically to give you some milestones to say, boy, we need to change our plan? Or, it feels to me like we watch water intake and we do injections. Should we be thinking about other ways to monitor those groups?
Yes, but I don't know that I have any practical solutions. I mean, you hit on water, and that's probably the most practical thing that we monitor today and react to, that or individual animal treatments. There's been a lot of work with the cough monitoring programs, and in my limited experience with them, it's been good, limited but good. And when you look at it retrospectively, they can definitely pick up a respiratory disease increase. So I think as those sort of sensor technologies get better, we need to embrace them as quickly as possible.
I think the aspect of wide-angle camera, if you have very standardized finisher or nursery setup, that we talk about some company looking at machine learning capacity and look at behavior animal, and then if you see movement going down, that you could detect those activity. Is it going to be more perceive it better than an employee would? I don't know, but there would be a way to standardize those approach better. Other than that, a lot of it for us relate to acute problem or horizontal transmission. Like you said, you don't see a lot of contamination of young pigs before 8-9 weeks of age. And following what we call our phase 2 mortality, which is our mortality that happened in the late phase of nursery, it's really the thing that will trigger more severe intervention, because usually what we are dealing in phase 1 is what we're dealing with, the disease coming with the sow farm. But where we can have an impact on what we're going into, it's really in that phase when you look on your daily mortality.
Since everybody's bashful, I'll ask one more question. Are any of you doing anything differently from a management perspective? The tendency is I'm going to overcrowd the pigs because they're going to have a higher mortality. Are you actually going to lower densities? Or is anybody doing anything like that, raising set points, those sort of things, when you know that flow's got issues?
So we have looked at changing our stocking densities. Sometimes it is intentional and sometimes it's not, just due to the mortality that we see. And we have raised set points and we have extended mat feeding. We have done a ton of different things. And I would say for those first 20 weeks where you're weaning really hot pigs, at least for our system, it has made little impact overall. The bigger piece that has made an impact for us is the immunity that the sow herd had prior to being exposed to their new wild type. That seems to be where we had just more success in having quieter, cleaner breaks that we could manage with a more appropriate mortality. So we've tried doing different set points. I would say that, maybe our execution was where we were lacking with some of those, but we've not necessarily seen a great response to those changes.
I just call Henry and ask him what to do. So I know I'll ask you and Mike and Kat, and you guys will have the right answer.
Yeah, I think you getting into faith-based intervention at some point there where people have very strong opinion, but not a whole lot of data. I believe when it start with that, that's where we got the issue. We start them warmer, we start them colder, we get them tighter. The only thing that I was surprised that we did in a controlled manner during COVID and to minimize the risk of having to do mass euthanasia was to with all callers state and said, can we increase our density in the nursery and keep more pigs there? And we voluntarily did that, and we were actually fairly surprised of the lack of impact it had to our overall livability and growth in those pigs, and say that was something that didn't actually. Usually, when we take those type of decisions, they always end up biting us in the butt. That one did not actually in that aspect. So if there's an issue with concentrating on not having more pigs moving with different regions, so I keep them more into one nursery and keep them tighter, we would look at that. But those always come back to discussion with your authority that will allow you to be, if you go above your environmental capacity in those sites.
So one thing in our system that we've started looking at more is how do we adjust the nutrition that we're given to these pigs, knowing that vitamin and mineral deficient pigs are not going to have as robust of an immune response, which has then prompted us to go back and kind of retrospectively analyze our sow nutrition planning. Is that something that y'all have started looking at, or that you do change as kind of a PRRS response plan as far as your sow nutrition?
No. It's a good question, but I don't have any good knowledge to offer up as part of the discussion. So specifically on the sow side, I think it's still an open question on the growing pig side as well.
I would agree, and it's something that we have just started looking at because of some other issues that we've seen within the system. But it's something that our nutritionist is digging into because, at least for our system, we have seen horrendous mortality, and it's hard to believe that, yes, sure, this virus has changed, but we aren't dealing with the variant, and we've seen horrendous mortality. So to us, it's something that we do think our nutrition is impacting it, and we're either not feeding them appropriately, not making the feed correctly, or we've missed a really big piece into that. So we are digging into that.
I bring it up every time our nutritionist think we don't have the wrong medication in the feed.
That's a great answer. And it's a good time to look at all that, right? I mean, we look at all that stuff after COVID, right? We start talking about ivermectin, but actually there's been a fair amount of literature to really show the impact of vitamin D in particular with COVID patients. And you look at JQ's work, right? It's all about, with COVID, it's all about type 1 deficiency. And they really were able to show a very clear link between vitamin D deficient people and ones that had more severe outcomes with that. So, it does make you wonder about the same sort of situations here with the amount of virus that we're now dealing with these high path strains. So that's a good thought. Hope you learned something there. So, other questions? All right, you're going to force me to go to my list here. Come on, people. Let's go. Do you guys adjust feed medications ever for PRRS-related outbreaks, or do you guys keep that pretty static and just adjust it using water medications?
Talk about feed?
Yep.
We don't. Actually, we stay on fairly standardized program, which in that nursery phase is really more respiratory driven.
More respiratory driven, okay.
I do sometimes, but honestly, Chris, a lot of times it's admittedly smoke and mirrors to try and demonstrate that we're doing something different to try and help. But my goal is primarily not to add cost at that point. Take something out, add something new in that's similar in cost, and feel like we're doing something.
Yeah, I would say most of our feed strategies are used to mitigate something else, whether we're seeing, might go late or something to that effect.
Got it. Okay. We got one. Okay, Mike.
Question. So it still seems like there's a number of nursery groups that get infected with PRRS late nursery. Then we put them on a truck, and then the first month of finishing is really, really tough. And so I agree with what Paul said on sow farm filtration. I mean, I believe it works. Is anybody filtering nurseries to help keep them PRRS negative through at least the nursery stage in a traditional setting where we have nurseries and then finishers where they got to move on a truck? Knowing that I think there's still a lot to do around conventional biosecurity of the nursery. I get that, but just wondered if anybody's employing that strategy.
We are not. I can't even convince him to do sow units yet.
My only experience, Mike, would be in the context of an isolation nursery essentially attached to a sow farm. So can you filter them? Absolutely. And with excellent success, right? We've probably all had experiences where the sow farm breaks, but you're going to keep bringing in wean gilts for a while, and the ISO never goes positive. Right? You batch those gilts through there and the ISO stays negative the whole time. So it can absolutely be protective, but I don't know anybody that's really built much for new space at all in the last 2 years, and nobody on the nursery side. I think Ross presented one several years ago on a wean to finish site that, if I remember right, they were playing around with filtration and maybe even filtering the air or doing a water bath on the way out to try and reduce particles in general coming out. But I haven't seen anything more recent than Ross's presentation.
And we don't have much sow farm that are filtered anyway. So, on the nursery, but you would think with the amount of air you bring that would be something that could be fairly easily done. But if I had to choose, I think I would rather do wean to finish and have pigs stay in one region and moving less animal between region. And then usually I think that from the limited data I got of late break PRRS in the nursery, those pigs, or nursery age break, those pigs do much better if they are in finisher, you don't move them, than if you transfer them in the middle of the break.
A quick question for the group. We saw, like Gustavo mentioned in his presentation, like if you're monitoring like sows of feed or abortions in the sow farms, we have some KPIs that are good for at least trigger some more intense diagnostics. Did any of you guys try to monitor something like, I don't know, water consumption, feed consumption, or number of deaths in the growing phase per week that could trigger a more intense diagnostic on those sites? Because it looks like we are kind of a little bit behind or lagging to when things happen, and when we do the diagnostic, it's a little bit late, and we are doing a pretty good job on the sow farm, but we're still missing on that part.
We use diagnostic in the nursery a little bit more retrospectively. And I would tell you in the sow farm, it's usually the case. It's rare that we will have diagnostic that will allow us to do an intervention before the things actually happen. You can catch it earlier in phase. But in nursery, we basically submit tissue from every flow of nursery every 4 weeks. So you see what's going on in those flow. If mortality change significantly, then we collect tissue. We do a lot more sequencing of PRRS virus in nursery that we used to do in the past to see are we seeing leakage, are we seeing lateral transmission, and then that is done, and then we will sample depending if we're moving pigs between region. Then if they move from not for Iowa, because Iowa is the garbage can of the swine industry, so everything's going down there. Sorry, guys, but if you're moving to a region that you expect as a different status or higher cell status, even as a feeder pigs, those pigs will be tested for movement. We went to some extreme, even if you look at where we are in the Guyman region, where we don't have any 144 virus there. If we bring pigs from another region, they will be tested. Market pigs will be tested to ensure that they are not circulating PRRS at the time of movement. Because when it's get into an area or capacity of limited transmission, there is very limited. So regional biosecurity is extremely important. The advantage we got where we are is we're most of all the density of animal. So we are responsible for what we're bringing in and out. So that's why we doing as much testing on everything is coming into the region, even if they are high health and even if they go to market.
I would say most of our stuff is retrospective, even if it's just how far retrospective is it. So we have some stuff that we can project what our mortality of that lot is going to be, and so if it is out of reference range on that projection, then we'll absolutely go in and grab tissue. But again, that's a weekly report, so you're anywhere from 1 to 7 days from when there might have been something of value to go get. We are not good at tracking water or feed intake. It's something that we're looking to get better as a system, but today I couldn't go in one location and say, here's all my water consumption for all our sites, here's our feed. All it would be is feed disappearance. None of it is actual true consumption. And I would say that's even the case on our sow units. Most stuff is, right, because if they're clicking along, you're not too worried about them, but normally something has changed, either their abortion rate picked up or sow deaths or whatnot, and that's what prompted you to go get diagnostics. So, not a great system, but it's what we use.
Quick.
So the only thing I would add that we do a little different than anybody else is we don't have a pig champ or a meta-farm system. Our system is in-house, but all the mortality and all the KPI are reported daily to a centralized system. So any mortality change that happen daily, we basically look at it every morning, and you have the result from the day before. So those allow you to, although you would think, okay, if something like that happened in the sow farm or a finisher, they would contact you immediately. But that allow you kind of a faster response on the mortality side of it.
Question about Sorry, since I started, so can go next. So, quick question about managing expectation. Like Luke said, there is no silver bullet out there like a PCV2 that you just vaccinate and turn your back, go do something else for the most part. But there's things that you can do to bring, like you said, from 25 to 18%. I would still classify that as a success and the right thing to do for the pig and economically too, right? So how do you manage that expectation that you're dealing with something that whatever you're going to do, it's not going to bring that to a 2% mortality, but it's still going to bring some significant performance to the system. How do you manage that expectation with the system?
You do, I mean, in a larger system, you do trial. You have to show that stuff still bring value to the system. And that it's an economical response. And I mean, I've been pretty vocal that you don't want to tell pharmaceutical company that their shit is working too good, because then they stick to it. And in the reality, it has lost benefit. Does it still bring value? Yes, but it's not an acceptable response. We have to find something better in what we're dealing with. But then on any type of solution that you bring, there's a balance of looking at what is the return on it and are you making really an improvement. You've got to be continuing to do those trials to ensure that those things are bringing solution to the table that are effective. The rest, it's very hard to convince people when they see a 25% closeout that the vaccine brings value unless you say, look at the data, and then they say, okay.
I think in today's pig industry, Daniel, most of the time the people taking care of the pigs do not own the pigs. I think you can somewhat ignore the economics when you have one-on-one conversations with those people when you're talking about these pigs are really sick, what are we going to do about it? And what I mean by that is it's a results-based business. Don't get me wrong, right? You can't live with 20% wean to finish mortality. It's not acceptable. But it's going to happen at one site sometimes. There's nothing you can do to prevent it. Focusing on the process with the caretakers, like Brigitte said, focus on getting the environment right. Focus on making sure the barn functions the way it's supposed to. Focus on getting the chores done. If we do those things correctly, we are successful, even if there are a lot of pigs dying at the same time. Because what's causing the pigs to die, the reality is we don't have a tool to fix that. So, break down things into what you can control and what you can't control. We can control if the pigs have feed or not. We can control if the environment's appropriate or not. In a hot break of PRRS, you can't control which pigs are going to die and which pigs aren't going to die. So it's difficult, but ignore the outcomes. Don't use that as your measure of success when working with that caretaker or that farm manager. Focus on the process, and if the process is good, if you audit the process and they're doing that correctly, cheerlead it, right? It's no different than our kids, right? If our boys lose in a soccer game and they were playing kids that were 3 years older than them, they didn't lose, right? They were a success if they tried really hard and they did everything that they could. And that's the reality, is sometimes you're playing against an opponent with PRRS right now that is going to win the game, right? So do what you can to be the best producer you can in the situation. Judge yourself by how you manage the process, not by the results, because the results are gonna suck.
I would echo all of that. And then one big thing that we've looked at our system is actually rewarding the people who are doing the process correctly rather than the results at the end, because obviously we're a larger system, so we do a bonus program, right? So we have people who've worked with us for 10 years and never received a bonus because all they deal with is PRRS pigs. And so that is part of managing the expectations, because if you work towards something that you're never going to get, you're just not going to work towards it anymore.
And I would echo all of that, and we do the same thing. I mean, our audit are based on process and are based on results, and bonus are based on audit results, which mean if people do what they're supposed to do and control the thing they can control, and you keep them to do and you're rewarded that way, that's the way they think. Because there's farm you go, and if you get PRRS naive pigs and you have great results and your process sucks, you won't get bonus. You have to do the right job.
Along the process guidelines that you just laid out there, in an acute outbreak situation and Grow-finish and pigs are lethargic and that kind of thing, do you have any recommendations or guidelines that you give caretakers on walking the pens once, multiple times a day? Good, bad, which is more better? Is one and done good enough? What's your guidance? I mean, coaching those caretakers through that.
I'll kick it off. Every situation is unique, obviously, Todd, right? How much labor do we have available, and what do those folks know, and what are they capable of? With unlimited labor, I would absolutely say get those pigs up. I mean, just the process of getting them up multiple times a day will encourage feed and water intake, and ultimately the eating and drinking is what's going to keep them alive. I had a good vet school professor, he said, your job as a veterinarian is to keep the animal alive until their body heals itself. And a lot of that is taking in the nutrients that they need to. So yes, have them go through multiple times a day, every couple hours, get them up to eat and drink. If they can gruel feed all the pigs, if you have the equipment, the supplies, the capability to do it, and to do it right, not just say we're doing it, but gruel feed correctly, right? Mix it appropriately, they consume it in 30 minutes, make that a part of it. It's rare that you have the labor to do that, but if you're in that situation, I do think that those things have a lot of value.
I'd agree.
Got one down there? Okay.
Following up on Daniel's comment, one of my questions, I think, is to Luke and his comment about vaccines and vaccines not working right now or not working. I guess my question, one of the questions I have is this a historic decline that you're seeing? Is this because of the variants and the strains that you're seeing now and the change in PRRS virus? Do you feel like that those are things that are making the vaccines not work as well? And what's the future look like there?
This is yes and yes, and I mean those are great questions. At the end of the day, what we look at is how those vaccine trials compare early on versus now, how they look. And when you look at when we used to do PRRS challenge, we used to not kill 7 out of 8 pigs, and now we do. So those viruses are a lot more virulent than what they used to be. And that's why when I say we lose the battle is that we allow those viruses to get more and more infections, which is fairly extraordinary when you think of that, because usually virus will find a way to replicate. They don't want to kill their host. Virus want to replicate, and usually most virus will move to a least virulent version of them and be successful, replicate that way. And that virus just do the reverse. And at this point, when you look at what we're putting in place, I think our way of looking at it need to be a little bit different on the growing pigs, and we need to do. My issue right now is we still try to look at the same vaccine and comparing them and show it they're better than nothing. And yes, they're better than nothing, but they're less effective. Can we bring new strategy at the table to be able to protect the animal better than what we're doing right now? I don't have the solution. It's not an easy one, but it's an area that I think we need to say, yeah, it is an issue, and I think it's an issue at the sow farm level too, where we used to see a huge difference in break between naive farm and vaccinated farm. They're not that different anymore.
I would just add that everybody knows that PRRS virus mutates a lot, right? It just spews out mutants into the environment, but we create the environment that selects for the next generation of viruses. And that includes our biosecurity pressures, which are artificial selection techniques, our vaccination programs, which again are artificial selection techniques. So as horrible as this sounds, we select for the viruses that can escape our plan today, and they replicate in mass. And when we have multiple wild type strains on one farm, and then eventually in one pig, and then eventually in one cell, and they recombine, we accelerate that process even further. And so I think the elephant in the room for us as an industry is that we are getting what we created, right? The outcome we have selected for. And for us to see a radical change or to turn the tide and move in another direction is going to take structural changes to our industry that are not practical, so they're not fun to talk about. But if that's the improvement that we seek, it will take something fairly revolutionary, I think, to get around that.
Like what?
So we absolutely need better tools for eradication, right? One of the big pieces I said there was recombination. Okay, we can't eliminate wild type viruses on farms fast enough to not have there be multiple wild type strains on farms. So we need better tools to help us with elimination at the individual site level in a manner that's faster than 30 to 50 to 70 weeks. Whether that's a better vaccine or whether that is a genetic resistant pig. It's a frustrating part is we could have a huge piece of that puzzle that is alive and well today, not very far away, a couple states away, and we just don't have access to the technology to do it. We need new technology is the very oversimplified answer, but specifically to help us eliminate wild type viruses from individual farms much faster than we can today.